Stop scrolling and watch this before your next fertility appointment. I'm about to share what happened with my patient with 3 failed IVF cycles who got pregnant naturally in just 4 months. This isn't about bashing IVF, it's about what your doctor might have missed. And stick around until minute 12 because I'm sharing the exact protocol that helped women avoid $20,000 plus for IVF cycles. Before we dive in, this isn't medical advice. I'm sharing research and real patient cases to help you make informed decisions. By the way, I'm Dr. Omatma. I'm a naturopathic fertility doctor, and I've been in practice for almost 20 years. So let's dive in. After having helped thousands of women both through IVF cycles and natural conception, and analyzing every major fertility study from the last decade, I've discovered a shocking pattern in who needs IVF and who just doesn't. Let me talk to you about when IVF is absolutely necessary. If you have blocked fallopian tubes, unfortunately, IVF is probably your best option, unless you can manage to open those tubes, and it's a challenging process. So in that case, IVF would be a really good solution, and it's still ideal to optimize your body and optimize your hormones and egg quality before you even still go to IVF. But if you do IVF in that case, that's totally reasonable. The second is severe male factor infertility. Now, IVF can't overcome all male factor issues, but when men are really struggling, if they have severe sperm deficiencies, if the morphology is super low, if the motility is super low, or if the count is super low, unfortunately, IVF in this case actually does make a difference. Again, the same thing applies. It's almost always better to optimize so you can do less IVF cycles, but IVF still may be necessary. And the last is going to be advanced reproductive age with very low ovarian reserve. Now, some of my colleagues that do natural and functional fertility do have success with these cases, and I myself have had some success with advanced reproductive age and women who have very low ovarian reserve, but this is usually on a case-by-case basis, and I evaluate extremely thoroughly in these cases because sometimes it's just going to be necessary to have an egg donor. So in those cases, you don't want to spend a ton of money doing natural things or even doing IVF cycles in that case, because an egg donor is the best option if you are of advanced reproductive age and you don't have that many eggs left in your ovaries. But here's what most doctors won't tell you. Up to 30% of IVF cases are labeled unexplained infertility. That's medical speak for we don't know why you're not pregnant yet. Drop a heart in the comments if you've been told you have unexplained infertility. And just know you're not alone. Here are 3 critical factors most fertility clinics aren't testing. Inflammatory markers. These are simple blood tests that can reveal hidden fertility obstacles. One of my patients had perfect hormone panels, but high inflammation. After addressing the inflammation, she got pregnant naturally. The second is thyroid dysfunction. Standard thyroid tests just aren't enough to reveal what's happening and do we have optimal thyroid function. Thyroid hormones are extremely critical to be optimized before conception. So you need these specific markers tested in addition to thyroid stimulating hormone, or TSH, which most doctors do in a fertility evaluation. The other ones that you need is free and total T3, free and total T4. Sometimes we do reverse T3. It's helpful to know if you have high stress or inflammation or heavy metals. Reverse T3 is going to be higher. And then antibodies to your thyroid. This is going to be TPO, anti-TGA, and TSI. These are 3 specific antibodies to the thyroid that you want to evaluate and make sure that you don't have dysfunction that's actually happening in your immune system, not necessarily in your thyroid. The third thing that most doctors don't evaluate is the gut hormone connection. Research shows that gut health directly impacts hormone absorption, egg quality, implantation success, and so much more. Comment tests below if you want my complete fertility testing guide. Let me tell you about Sarah. After 3 failed IVF cycles, she came to me completely frustrated and broke. Her tests showed that she had normal AMH, she had regular cycles, her hormones looked good on the surface, and she had pretty good egg quality, but she still wasn't pregnant. Here's what we found when we dug deeper. We found hidden sources of inflammation, subtle thyroid dysfunction, and gut dysbiosis. All 3 of these issues are going to have an impact on whether or not her body allows her to get pregnant, especially inflammation. It's a subtle way of the body feeling unsafe in your own body. So it's extremely important that you have a more thorough evaluation so you can know exactly what's happening under the surface. So for Sarah, 4 months later, she got pregnant naturally, and the total cost of her treatment was half the cost of a full IVF cycle, and that doesn't even include all of the medications and additional things that she would have to pay for if she was doing an IVF cycle. Here's the exact protocol that we used. The first step was investigation, really comprehensive blood work, food sensitivity testing, and gut health analysis were crucial in helping us understand that she did have inflammation and her thyroid was not functioning optimally and that she had dysbiosis. The second step was really building a solid foundation. In the morning, we encourage her to start her day with specific anti-inflammatory foods and targeted supplements. Then we went through a gut healing protocol where we could address the dysbiosis. And in the afternoon, she was doing stress management techniques because actually her hormone labs did show that she was getting extra stressed. Specifically in the afternoon, her cortisol levels were peaking. So we did put in some fail-safe measures to lower those stress levels at the most needed time for her. We also put in fertility-safe exercise regimens and additional nutrients in the afternoon. And the last step was her evening. Sleep hygiene is so crucial. I say this in almost every video. Sleep is essential. The sleep-wake cycle is the foundation of your hormonal balance. So if you're not sleeping well, your hormones are going to be out of whack. So for her, it was extremely important to get herself to turn her phone off before bed because she's a little bit of a workaholic and she was working on her phone. She wasn't on a computer, but working on her phone, responding to emails and text messages way late into the evening. She also put in a few hormone supporting practices and prepped for the next day, again, by getting really good quality sleep. Phase 3 of her optimization was working on her hormones. We put in cycle-specific nutrients and targeted supplements to support her hormones to have the optimal cycle through follicular and luteal phases, as well as made some lifestyle adjustments to support her cycles. Before I share the final phase, let me show you something fascinating. Here's a chart of what success rates look like through IVF at all the different ranges and what success rates have looked like in our practice. Essentially, for us, success rates under the age of 38 are 85%, and success rates over the age of 38 are 50%, drastically different from what IVF success rates look like at all the different ages. And not only are we successful with getting people pregnant, we're really tracking whether or not they continue that pregnancy and carry all the way to term. So our success rates are not based on positive pregnancy tests, but they're based on actual babies born. Now, here's how to know if this approach is right for you. As we discussed before, there are a few red flags for the natural approaches. I would not work with us if you have blocked fallopian tubes no sperm or severe male factor infertility, or diminished ovarian reserve due to age. Those three are red flags for getting more conventional therapies. But everyone else might want to consider more natural approaches and move to IVF if you absolutely need to. So the green flags for natural success are going to be unexplained infertility. I think that is the biggest factor that we address because we want to get to the root of it. There is no unexplained infertility. Most of the time, it's the failure of the medical system that hasn't figured out how to analyze and assess actually what's happening under the surface. So, unexplained infertility is our jam all day long. The second is recurrent pregnancy loss. A lot of women think that recurrent pregnancy loss doesn't have to do with fertility, but it's a different issue. I'm going to tell you that recurrent pregnancy loss actually is a fertility issue. When we approach it from the aspect of getting to the root cause, addressing all of the major factors that are happening under the surface, and move the body into optimal states of fertility, guess what? Most of those women do go on to carry to term when they get pregnant again. So recurrent pregnancy loss is our number 2 best case scenario. Third, if you have regular cycles, you've got normal blood labs, but are confused why you're still not pregnant, or you're under the age of 40 and have a really good level of AMH, those are best case scenarios for working with us and knowing that you are most likely going to get pregnant and stay pregnant so that you can have the baby that you've been dreaming about. I've created a free guide called the Infertility Blueprint to help you understand the potential root causes. You can evaluate this for yourself. And this guide also gives you the complete testing checklist so that you know exactly what your doctor has already tested and what might still be missing. Now, not only that, you want to get the exact reference ranges for what's optimal so that you can know whether your labs were just normal or are actually optimal in their much tighter optimal zones. If you do have optimal tests, that still leads us to, well, you probably have unexplained infertility, and we need to do a little bit more digging to figure out what is going on. Click the link in the description to download it below. If you want more evidence-based fertility tips, hit the subscribe and the notification bell. I release new research breakdowns every Thursday. Leave your biggest fertility questions so that I can answer it in a future video or personally respond to you with specific suggestions for your situation. Remember, IVF is an amazing tool when you need it, but it's not always your only option. If you haven't considered naturopathic or functional approaches to fertility, definitely reach out. We would be happy to do a secondary evaluation and see if you could be helped through the things that we do so that you don't have to go through yet another IVF cycle or even get into IVF if you don't need it. See you in the next video.